85,000 healthcare workers are voting to authorize a strike. If they do, it will be the largest healthcare strike the nation has ever seen. So it is the coalition of Kaiser unions that represents these 85,000 healthcare workers. The strike would impact over 11 million Kaiser Permanente users across 7 states and Washington, D.C. The coalition of Kaiser Permanente unions will conduct a strike authorization voting beginning on August 26th. The vote will last through mid-September, and said Dave Reagan, president of SEIU United Healthcare Workers West, at a press conference. If union members vote to strike, the coalition of Kaiser Permanente unions could walk as early as October 1st, with 85,000 members in its ranks. It would be the largest healthcare strike in the country's history. The coalition of Kaiser Permanente unions is a coalition of healthcare worker unions at Kaiser Permanente facilities in California, Colorado, Oregon, Washington, D.C., Hawaii, Maryland, Virginia, and Washington. Kaiser Permanente is known for providing patients with both coverage plans and health care under the same company. Kaiser Permanente has hundreds of facilities across the country, including 39 hospitals and 715 medical offices serving more than 12 million people. The coalition represents workers in 95% of these facilities, meaning more than 11 million Kaiser Permanente users could be affected. The call for a strike authorization vote comes 5 weeks before their contract with Kaiser Permanente expires. Union leaders say they are calling for increased staffing to protect patients and workers alike, as a raise in pay differentials for evening and night shift, and stability for remote workers. If Kaiser does not come correct in the next 45 days or so before the expiration of this agreement, there will be a nationwide strike that will be something that is avoidable. It would be a tragedy. It's not that the workforce wants to do it, but that is what we are being left no choice to do. Wayne Davis, a spokesman for Kaiser Permanente, told Insider that the union members should reject the call to strike. Oh my God. We take any threat to disrupt care to our members seriously and have plans to ensure continued access to health care by our members, patients, and the communities we serve. Should any union call for a strike, Davis wrote. Union representatives said that they understood that the strike would affect patient health care, but that staffing issues at the company were already negatively affecting patients and workers. A strike would cause delays, but do you know what else causes delays in patient care? Not having enough staff to treat the patients waiting 6 months in Colorado for a radiology appointment. That causes delays in care. Caroline Lucas, executive director of the coalition, said that at the press conference, we should go on strike because we care about fixing those things. Yeah. The strike would happen on the grounds of unfair labor practices, including Kaiser Permanente's failure to bargain in good faith and failure to provide relevant information as required by law. Catherine Engler, a licensed vocational nurse and union member, said patients are slipping through the cracks as staffing shortages continue. I lie awake at night wondering if I did everything I'm supposed to do for both of my family and my patients, Engler said at the press conference. It scares me that we don't have enough staff. Healthcare workers are leaving the industry because they can't take it anymore, making the existing short staff crisis worse and hurting our patients. So let's see if they vote to strike if Kaiser doesn't come to the bargaining table.